All right. Can we start this again? Jim literally started and he froze immediately. Sweet.
Instantaneously. As soon as the recording started and he started talking, it froze.
Jeez.
It's because doctors aren't paid enough. All right, guys. Welcome in, ladies and gentlemen, and everything in between, to the Cellini Rounds podcast. I'm your host, Dr. James Cellini. I am a board-certified practicing, for now, veterinary neurologist and neurosurgeon. I'm joined by my two younger brothers, who one of which needs no introduction and the other needs all of the introduction because nobody knows who he is. We'll start with Dr. Michael Cellini. He's a interventional radiologist based out of New Jersey. He was born and raised in Manhattan. I meant to say Kennesaw, Georgia.
Facts.
And then I'm also joined by the youngest Cellini doctor. We like to call him the master of the magnet, the lord of the ring enhancement, and he puts the qualified in the word unqualified. Dr. Thomas Cellini.
Lord of the ring enhancement.
Do you think of these all day? What's Lord of the Ring enhancement? That's a good one.
The Lord of the Ring enhancement, the master of the magnet. And then you laughed through the end part of the joke. So thank you.
It was funny. What was I supposed to do?
Put the qualified and unqualified. Right. It was Jim's favorite one.
Yeah. That was the coup de grace at the end.
Yeah. Actually, so I have a couple of those too, courtesy of my friend Lawson. He was listening to the last podcast. He was like, I could come up with these all day. He called Mike the El Rey in radiology. He was the Count of Contrast, the Prince of Percutaneous. I was like, I'm 100% stealing those.
Shout out Lawson.
Yeah, shout out to Lawson.
Good for you. Did you see him?
Have I seen? No, not recently.
Didn't you go see him? Jim's frozen. Look at him. How stupid he looks.
What an idiot.
All right, guys. Well, welcome in to our podcast. This is episode 11.
Bootleg ass podcast with this internet.
Yeah.
Welcome to this bootleg podcast.
We should call this podcast 30 megabits per second.
I wonder if Joe Rogan has these internet issues.
I think so.
I think he does.
Jamie, check the upload rate.
Yeah. I think we're gonna be picked up by the Nelk boys pretty soon here.
Yeah, we're joining.
Featured on it.
We're joining their tour podcast group.
Yeah.
I think Steve Will Do It has just as many internet problems as we do.
I think so.
Yeah.
But guys, just wanted to start off the podcast by seeing how you guys have been the last week and what's new. Michael, let's start with you. What have you been up to the last week? Let me guess. Enjoying your life and putting it on social media, but go ahead.
Yeah, I mean, that sounds a little bit like it. I didn't do too much social media action this weekend. I was on call, and as we know, there's those 2 16-hour brutal shifts. But nonetheless, we made it. Monday, I worked from home and worked all day this week. Did some cool things, did some cool cases with my partner / old fellow. And I have one more day and I get a week off. So I'm pretty excited about that. Just got to make it through another day.
Great. Tommy, what did you do this weekend besides get sick on Indian food?
Yeah, so I got the stomach flu on Friday night.
Hey, round of applause.
Yeah, hey. Spent about 24 hours vomiting in my bedroom, or my bathroom, I mean.
In your bedroom?
Yeah, it was close. It was almost in my bedroom.
Yeah.
But I was dead to the world, vomiting every 20 seconds. Apparently, Caitlin, she was like out to dinner with some friends, and she got home, and I was like on the floor, like leaning over the bed because I was like so sick.
Did you tell her?
No, like I was too sick.
You didn't give her a warning? Hey,
No,
I'm vomiting everywhere in the house.
She was like, "You look," she looked terrible. So then, as soon as she got there, I sprinted to the bathroom and like vomited everywhere. And she was like, "I've never seen so much throw up in my life." She was like, "It was so disgusting." She made the mistake of trying to get me to drink, or not mistake, but like the right move. But every sip of water just made me nauseous, and I just started vomiting again. So I slept on the bathroom floor until about 5 a.m. Then was stuck in bed, and I had that one last vomitus at like 2 p.m. on Saturday. After that, I was good.
That's pretty prolonged.
Yeah.
Do you think it's because you refuse to wear a mask?
I think it's actually, I think it's from the vaccination, if I had to guess.
Why does Jim always have to bring something like, he always has to do some stupid controversial comment?
It really does.
To like get us going.
Yeah.
Jim's like, do you think it's due to gas prices or what?
Yeah.
Do you blame Fauci?
Yeah. Fauci gave me the stomach flu.
Oh man. When's the, I haven't had the stomach flu like that. I remember I had the stomach flu in college like that. And it was the worst.
Thanks for asking me what I've been up to the last week.
This is
a really nice flowing conversation. So
I don't know, you freeze every minute. Sometimes I forget you're in here.
Yeah.
Yeah. Well, what I've been doing.
Let's see if we can make it through.
Experiences and me.
Let's see how long you can talk for before he freezes.
I'm the bad guy from Captain America, Winter Soldier, when he like puts himself into the computer.
Oh, here we go. These references.
Yeah.
You mean
you know what I'm talking about?
Yeah, I know exactly.
Yeah.
Where he
What's
shoots
the small German guy?
Yeah. Professor. No.
Professor X.
No, yeah,
it's not Professor X.
It's Professor
Magneto.
I keep wanting to say Zod, but obviously it's not Zod.
Zulu.
Thor.
It starts with a Z, right?
Yeah.
Here.
Anyway,
continue telling what you're doing. I'll look.
Hey, good talk.
Yeah.
So over the last week, I did more surgeries the last week than I have any other individual week since work.
I mean, look at
story,
this.
bro.
Man, you killed that story.
Yeah.
Man, you killed that story.
Dr. Zola.
Yeah. Dr. Zola, that's right.
Yeah, there you go.
No, I did. I cut a bunch of dogs' backs and necks. When I say cut, I mean did surgery. That's just shorthand for saying that.
Who says cut? Do you guys say cut in the business?
Yeah, we say cut in the business.
Really?
Yeah, like
sounds very
morbid. Does this dog need to be? Does this dog need to be cut? Sort of thing.
Isn't that? I feel like all surgeons say stuff like that, right? In human medicine, they do that.
No, I've never heard a surgeon say I need to cut him.
Oh yeah, dude, I've heard surgeons say that all the time. But you
Really?
think we'll need to cut this person? I'm like, I don't know, man. Isn't that your job?
Oh, I don't think I've ever heard someone say cut. I need to cut them.
I think it's because no one trusts your reads, and so they probably don't even bother.
Yeah, bro. Yeah.
Yeah, right.
They trust my reads. No, I don't think I've ever heard of that actually.
Professor Zola for the listener, the viewers.
First
Yes,
off,
that's what I sound like.
what year is that? It's like, is that DOS?
It's supposed to be.
Yeah, that's the whole point.
Yeah.
Oh, okay.
He basically,
sorry guys.
He uploaded his consciousness into this like huge computer, like underground computer system. Once the
from 1980.
No, it was like 1940, 1950, something like
that. He's like a conscious DOS prompt.
Yeah,
it looks like a World War II missile silo.
That's exactly what it is, actually.
Really?
That's exactly what it is.
That's what happened.
Let's go.
I nailed it.
Yeah.
No reference.
Well, I have to give credit to the movie then, because I have known nothing about the movie.
Yeah,
I wish you the.
What?
Okay.
What? Jim, I mean, I can't handle.
I was trying to make a joke, and
Oh. Let's get on with the topics. Right. Jim, make it brief.
Okay, so guys, I will do my best to very quickly summarize the topics of discussion today.
How about you just let us summarize?
All right. So the first topic of discussion, I mean, if you want, the very first topic of discussion today comes from the dailymail.com. And I know that a lot of news sources are like left or whatever. I don't know what is what. So just bear with us, because I honestly have no idea if this has like a political bend to it. But apparently a North Carolina medical student was put on leave after tweeting about deliberately injuring a patient because the patient mocked her pronoun badge. But the university says she didn't intend to harm the man. So what happened here was this Wake Forest, the University School of Medicine student, I'm sorry if I'm mispronouncing this, Del Rosario.
She might threaten to injure a patient after you mispronounce that name.
Yeah, right. So apparently she was asked by a patient when she was doing a blood draw. And he looked at her pronoun pin, loudly laughed to the staff. She, her, well, of course it is. What other pronouns are there? It? There probably is a pronoun called it, but I don't know. But she then goes on to tweet, I missed his vein, so we had to get stuck twice.
Not a good thing to tweet as a med student.
So here's a bit of advice. I was in vet school right before Twitter debuted, and I might have done something stupid like this, but nobody cares about some random vet student at the University of Georgia in 2005.
Right.
It's probably best not to get on social media and say stuff like this as a medical student. Michael, why don't you take it away as the lead social media content creator of this podcast?
No, I totally agree. I mean, social media is a blessing and a curse, especially for the medical industry. It's great for med students.
Stock response that is.
No,
hey, Tommy, let's move on to you.
No, let me finish.
Some things are good and some things are bad.
I was just getting started.
Things.
That was the opening statement. I think it's great because it, allows people to connect with other people and like med students, the like-minded people who, weren't able to share resources and all this stuff, but also negatively with stuff like this, because you have to be so careful with everything you say, because especially on Twitter, because they will dissect everything you say. Like I thought like a Twitter person as soon as I read this, so he had to get stuck twice. She didn't put like a smiley face. She was like sad about it because, it was an accident. But then people are like, so you purposely stuck him twice because he didn't like you? Who are you? And then they will like go email the med school and like, especially med students, they're constantly under the watch because they don't really, they're not really sure about what they're doing anyways. So they post stuff like this. They're like, we're going to call the med school dean. We're going to have them, so they have to. I wouldn't even tweet as a med student, to be honest with you. It's not even worth it.
I mean, I bet there's two things happening here at once. One is that she's not getting berated as bad as she's claiming. And two, she also is not injuring this person nearly as bad as they are reporting and is being reported. I think both of those things are true, if I had to guess.
Yeah. I mean, look, realistically, if a med student's drawing blood, chances are they're going to stick twice just because they're learning.
Yeah.
So she probably said that because, but I can see how it had a negative underlying negative tone to it. So it kind of like walked the line a little bit,
Yeah. Also, anything her that can be left up to misinterpretation will be misinterpreted. So
correct.
Like, even if you're like making a joke, like a tongue-in-cheek joke, it's like it will get misinterpreted. It is unfortunate that a patient will say something that upsets you.
Right. That's what I'm trying to say.
But it's also it's not like a colleague that's like saying something to you in a workplace. It's like these are your patients. Like I know we discussed about like physical harm and like assault for patients in a previous episode, but it's like you still like there's still kind of a leeway there where it's like the patients have more leeway to say stuff to you than like your fellow colleagues.
The patients just say whatever they want with no consequence.
Also, med students, especially like if you go straight from college, like they're like 25 years old. That's still like a child. Like you can make dumb mistakes as a med student and be like, I just thought about tweeting about it. And it's like, yeah, well, every 23-year-old, 24-year-old is going to tweet out what they feel every now and then. And it's like, can't really do that in medicine.
And you're dealing with a lot of patients who are from every walk of life and from every viewpoint of any possible political or religious or whatever avenue where they're coming from at this. And a lot of them are very outspoken, and you're going to hear stuff like this in the hospital all the time.
Yeah. I don't
I'm not saying it's right.
Yeah. I don't think that here's the thing, a lot of this comes down to like, was there actual harm done to a person? And there wasn't. Like she didn't intend to like keep jabbing this guy.
Yeah.
And she actually did miss his vein. And she's just saying that like, I missed it. She honestly missed it from what I gather. And she's saying he had to get stuck twice. And down here in the article, they clarify that she had like a senior doctor do the blood draw after she tried it.
So let me ask this though. But the thing is though, is why did she even mention that she had to stick in twice?
Yeah.
That doesn't add to this whatsoever. That's
Well,
just
I mean,
like,
it's
so that's why I think there's kind of a negative undertone, like,
yeah.
you know what I mean?
Yeah. And though, like we were saying, it implies that
Right.
it happened because of the preceding events. So she's like,
And
well,
I'm playing devil's advocate here because, you know, obviously I'm guessing she meant good intentions here, but
Right.
I can see how it can be misconstrued. Now, if she didn't have the face of the crying emoji and she had like a winky face, then it would be like completely misconstrued.
So what ended up happening with the med student? She got like
I think she
where was
let's
this?
see. This is at Wake Forest.
Oh, wait. Oh, right around the
Yeah.
corner from where I was.
Let's see. It says Del Rosario was slammed online last month after tweeting with the tweet that
I
we
can
just showed.
imagine.
I can't even begin. And let's see.
This is why you can't just, as a med student, just don't tweet. I mean, get into residency.
Despite the malpractice, students from Wake Forest University backed her up and hit out at the victim. Ewan Liu, I hope I'm pronouncing that right. I'm sorry if I'm not. Also a medical student, said, I heard this story firsthand weeks ago, and it seems like there's a lot of bracketed words here. I don't know. It's when they're this frequent in the I heard this story firsthand weeks ago, and it seems like people are misinterpreting. To clarify, the misdict was completely an accident and just seemed karmatic.
Yeah, that's what she was saying.
Honest mistake.
Yeah, that's what she was saying, but you can't say that to people who aren't in medicine because they don't understand that. They think you're purposely harming them.
Yeah.
And I'm sure people on Twitter just had a heyday with this.
Yeah. I mean, and true, like from the patient standpoint, it's like, how am I supposed to read that you as a medical professional are like actively tweeting about my case?
That's the other thing.
Yeah, it's like you're tweeting about my case, obviously, and it's like that's not probably doesn't fall under the HIPAA realm, but it's like we're getting real close to the edge there, and it's like
very close. Very good point, Tommy.
Like if you imagine someone sitting there and be like, you're literally telling people that like my conversation I had with you and all this stuff, and they're like, how dare you come at me like that?
Yeah, I mean, I don't know. I think that's the thing is, if a patient is on Twitter and sees that, they know that's about them.
Yeah.
You know?
Yeah. So the article also highlights some of the best comments from, I guess, the Twitter thread.
Oh, let's see.
One woman called Christina posted, she is a disgrace to the profession of medicine.
This is, I mean, you gotta love Twitter, right?
That's so over the top.
Everything's so polarizing.
Michael just had a video about a doctor purposely killing people. He's just like, nope.
Right.
This girl, she's
a disgrace.
That guy's a disgrace, and also this med student's a disgrace.
Yeah, they fall in the same category. The same category in my book.
Everything's extreme.
Yeah.
Yeah.
There's no nuance.
Let's see. Christina goes on. She should be dismissed. We physicians will always encounter people who are not kind, and we need to treat them equally.
We physicians will encounter people who are not kind, and we need to. I mean, yeah, I agree with that because I mean, think of how many patients you see on the floor who the problem is the patients may not even know they're doing that to the provider. You know, they may be delirious. They may be, you know, on medications. They may have mental illness. I mean, so much stuff goes into it. So you can't, you know, you got to just kind of let that stuff fly. I've been told so many different things in my time. And you're just like, okay.
Yeah.
The person making excuses. Yeah. The person making excuses for her obviously has an agenda, and it's displaying poor judgment as well.
What?
Truly disgusting.
What agenda could that be?
I just love how polarizing everything is.
Yeah. I mean, I think mostly is like, it's just one mistake. She shouldn't have done it. I doubt she meant specifically what she did, like when she was saying like wanting to stick him twice, but it's like, it's just an honest mistake. Should she be reprimanded in some form? Like, yeah, but should it be some large degree, but like dismissal from medical, like
That's
the medical field? Yeah, like that's extreme. But it's like
she should be educated on social media and what's right and wrong to say on social media and how to treat patients. So that's it. I don't think. I mean, there's clearly no. It's not like she was like, so I, stabbed him with a. Yeah, or I don't really know what,
I wanted to take a scalpel and slit his throat. It's like, whoa.
So I put in a central line in him because I feel like he needed that more. Like it's not something like completely unneeded.
I was putting a central line, purposely gave him a pneumothorax.
I practiced my craniotomies on him later.
That would be intentional negligence, which,
Here's a question. If a student went totally rogue and psychotic and decided to just like take a patient to get a craniotomy and try to just like get a crazy procedure done because they were nuts.
No, wouldn't happen.
How far into the process could they get?
Nowhere.
They couldn't even book an OR.
You can't even go anywhere, right?
They would. No. Everyone would be like, "Who are you?" Be like, "I'm a med student." And be like, "Get the out of here."
You'd have to book an OR. I mean, those things are booked up all the time.
Yeah,
all day. Every day.
Like 20-year veteran surgeons that are like grinding out OR time. It's like some 4th-year med student looks like a kid and is like, "Hey, I want this OR."
Here's a question.
A craniotomy.
You hear about all the time how people like have their wrong leg amputated, or like the wrong hand, or like a guy just gets his penis amputated when it wasn't even supposed to be a penis amputation surgery, stuff like that.
What?
You remember that story, right?
No,
guy just had his penis amputated. Anyway,
I don't believe that. Come on.
The point being, how do these mistakes happen, and what is the process in making sure you do the right, let's just say right, left, or right side, or the right like appendage?
I'm glad you asked this question because on the same day this podcast is released, I have a video that is perfectly made for this topic. But I'll give you a little gist here. I was basically comparing the similarities between the airline industry and medicine because there are so many similarities. And one is the checklist that you do before a procedure. So like a surgery, say you have a surgery on, first of all, extremity surgery is very easy to do the wrong side. Like think about it, because you're looking at a patient, it's opposite of you. You have to have all the documentations, and these orthopedic surgeons who are doing these extremity surgeries, they may do like 4 or 5 knee replacements that day.
And they're not there in the beginning. They come in with it prepped, and all they see is like a little circle, and they're like, that's the knee I got to operate on.
Yeah, right. But
that could be any knee ever.
But before the operation, so they have to see, before they bring the patient back to the operating room, the surgeon has to come over and put his initials on the right side. So, and that's all fine and dandy, but it can still be mixed up in the shuffle, someone's paperwork, maybe they wrote right when they meant left. Like there's a lot of things. It's really challenging. And I mean, I'm surprised it doesn't happen more often, honestly.
Yeah. I mean, think about like how many times you're reading a study or something and you'll be looking at like the left kidney. And you're like, oh, there's like a renal lead, like a complex cyst or whatever on the left kidney. And then you'll just say right. And you're like, what the hell? What am I doing?
I know.
Like,
I do it all the time.
Yeah. You're like, I'm glad I caught myself. And you're like, you catch yourself more often than not, but it's like, it would be easy just to say something.
Because it's opposite. Yeah.
Breast you're looking like that, side. Where it's like, make it very clear what side we're talking about when we're doing like screeners and diagnostics and stuff like that.
And then Jim, like you were saying, there's checklists in the OR. So once you're in there, you go over, this is the right knee. We're doing a right knee arthroplasty. We have all the components here, blah, 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 blah. So like there are checklists in play, just like there are in the airline industry. They're not going to take off without a full tank of gas. They're going to be like, oh, forgot to check that.
Cool.
Did I answer?
Oh, I'm just kidding. Yeah, I do. When I do back surgeries, the spine is like, pretty notorious for being like, well, the right and left looks exactly the same, and every little spot next to where you got to go looks exactly the same too.
Yeah.
So I like quadruple
1 centimeter away
every
from the wrong spot.
Yeah. Like almost every time before I scrub in, like I'll be scrubbing in and I'll ask an intern to like, can you just pull up the MRI one more time so I can see it?
Absolutely.
And I'll just get like one more like mental image in my head before I go in there. So
yeah, I do the same thing like before like a nephrostomy tube or something, because you're like, I remember seeing on the left, but then now the patient's prone, and I'm standing on the opposite side, it's like you have to reorient yourself a lot and be like, okay, just making sure here. Okay, got it.
Yeah, I noticed that IR stuff when you do CT biopsies when people are prone, that will throw you off. Like
they're prone, and then the opposite way. So usually
explain to people what prone is.
Prone is laying on your stomach.
Yeah.
So supine is laying on your back.
Every CT you read, imagine you're looking up from the patient from their feet to their head as they're lying on their back on a table. So it's like I'm looking directly from your heel up, and that's like the orientation you have as you're reading a CT. Well, when you flip someone and you're in the orientation of you're looking down from their head to their feet or they're on their stomach, everything gets turned around 2 different times. And so you get inverted. And so when you're used to seeing something 10,000 times in one direction and then it's flipped, it's like, whoa, wait a second. Like, what's going on? You go like stop and think about it.
It's backwards and flipped upside down.
Yeah.
So you really have to completely orient yourself, like completely opposite to how you're used to seeing CTs when you do a procedure. It's the like exact opposite and flipped.
Yeah.
If that makes sense. So it's really challenging.
Do you guys remember before you knew what you were looking at on a CT or an MRI? Do you remember seeing them and being like, what?
Yeah, I do.
I don't really.
I remember being an intern and looking at a chest x-ray and being like, what the hell? People would say stuff. I'm like, what are you even talking about?
Yeah.
And now I do that to people and they're like, yeah. I'm like,
I do that to people all the time.
I remember being a student and one of the neuro residents was walking me through a brain MRI. And I was like, dude, but you know, the whole time you're sitting there going, yeah, like that's, that's the rostral colliculus. Yeah, obviously. Right. Yeah.
Oh yeah. I was just saying.
Oh yeah. I mean, the medial longitudinal fasciculus is like right there. That's like the perioccipital gray. Yeah, obviously. Clearly. And I mean, of course, that would cause like vestibular dysfunction right there. I see what you're saying.
Clear.
Yeah.
But inside,
that's like child's play.
Yeah.
Yeah. I was like, give me something harder, man. Right. But internally, my real truth was like, I have no idea what this person's talking about.
Zero idea.
Yeah.
Not even remotely a clue. I don't even know a single word you're talking about.
I know brain and that's it.
Yeah. And fast forward 10 years later, and I'm like, I could literally be him to a different person as a student doing this. It's insane. And I'm like making clinical decisions based off of all this stuff, and nobody's telling me what to do. I'm just like I'm just doing it every day.
I actually remember for chest as an intern, like very early on, being like, for some reason, just chest x-ray. I mean, chest x-rays are hard. Fortunately, we have CTs and it just makes them kind of like obsolete effectively, but it's like
everything in human medicine is just like, just solve it with technology.
That's all you just go up the chain and be like, hey, if you don't have an answer, go up the chain to more technology.
Recommend a CT or MR. And I mean, you can't know everything though.
Yeah, but it's like, I remember like volume overload on a chest x-ray. I'd be like, dude, what are you talking about? Like, pulmonary artery distension? Like, I have no idea.
Like, what are you talking about?
Yeah.
I don't. The last time I remember was my intern year, when everybody knew I wanted to go into radiology, and they're like, "Hey, pull up the CT." And I'm like, they're like, "You show me where the appendix is?" I'm like, yeah, it's over here.
Yeah.
Oh, that happened to me. So when I was a rotating intern, I told people that I wanted to do neuro, and so like the back half of the internship, my intern mates would be like, "Hey, can you look at this dog and just tell me what you think?" And I would do these like. I mean, it was like my 2-year-old daughter playing with sticks and rocks is what I basically, and I would like do a neuro exam and give them an opinion on stuff. And I'm just like, I'm the biggest fraud ever. Like, but because I'm like 6 months out of school and I'm giving like a neuro exam opinion, like, But that was like, once you express interest, all of a sudden you become like the expert and people want to like talk to you about it. It's like, I don't know any more than you right now. I haven't done my training yet.
Yeah. I remember I did a surgical intern or a surgery like sub-I as a med student. And I was going in, all the people were doing surgery, going into surgery. And one of the chief residents, I was going into radiology. It was a 4th year med student. He started asking me questions about like a CT he was looking at. I was like, bro, I don't know. I was like, are you seriously asking me a question right now?
Yeah.
I was like, what training do you think I have in radiology?
Yeah.
You know what's weird though is now, like, I feel like when you start talking to other doctors and stuff, because in the real world, all the attending physicians, they're so far out of like residency training and stuff, so like they're so into their field, and they've mostly forgotten a lot of the other stuff like during the training. Like we still have some working knowledge of other specialties, but once you do the same field every day for like 30 years, you forget everything else, and they're just like, yeah, I'll take your word for it.
Yeah. I trust you.
Yeah, but I mean, it's hard. I take it for granted how long it took me to learn how to read these studies.
Oh yeah.
But
even like second year residents and stuff, they'll read stuff and you're like, what are you looking at, man?
I used to not be able to find a lymph node.
Oh, lymph nodes.
Now I'm like,
so hard.
I'm like, now how do you not know where lymph nodes are? They only live in certain spots.
Yeah, there's only a handful of spots they're gonna be.
Yeah.
They track up the center, basically.
Yeah. I used to be like, oh my God, I missed another one.
Yeah.
Like, how will I ever know where these lymph nodes?
What about like pulmonary nodules? You'd be like, guy, he used to name off every pulmonary nodule that ever existed.
I know.
Now I'd be like 0.2 centimeter, 0.1. And my things would be like a 0.1 centimeter pulmonary. What are you talking about? It's basically irrelevant.
Quick question: do you guys list 2 millimeter nodules?
Yeah. Well, no, so I don't.
What do they do there? I'm curious.
So 2 is like is like kind of the standard at our hospital. I hate that because it's like
I usually list 2.
Yeah, 2 is. I feel like 2 is even small. It's like unless you have a known cancer and it's new, like it means nothing until we see something change about it.
Right.
And so they'll say that, but it's like I don't know. I tend to not. I think 2 is kind of not worth mentioning.
For those of you listening,
like we'll have people. If you don't mention it, then like people call. I'll be like, why didn't you mention this 2 millimeter nodule? I'm like,
yeah,
this is not worth like.
That's the thing. So for those of you who are listening, when you read a CT of the chest, you see a pulmonary nodule on like 95% of patients, right? They could be they could be 27 years old, they could be 77 years old. Like you're gonna find a pulmonary nodule. And what we're talking about is usually we don't really talk about anything under 2 millimeters. But realistically, because people have pulmonary nodules all the time. So if you list every 2 millimeter nodule, you're basically enlisting them on getting another CT in 12 months just because there's a pulmonary nodule.
Yeah.
Which is a little extreme because everybody has pulmonary nodules. But where do you draw the line?
Right. It's like that's why they have like lung rads and all that stuff. And I don't know. Yeah. It's unless you have like a known cancer and we're looking for staging or looking for mets, it's like, and you see them. I always say, I'm sure you do the same thing. It's like when you're initially staging, it's like there are 2 millimeter nodules and it's like indeterminate. Just make sure you check it on the next time. If they don't change, they're pretty much not going to change. And they're just like normal nodules. That's
the thing is you can follow up these nodules until you're blue in the face. I mean, patients didn't follow up CTs for like 20 years. You're like, what are we doing here? Yeah. But you really don't care unless they're over 6 millimeters. And then you start getting like you're like, all right, let's watch this one a little closer. You get a 6-month follow-up. And then if it gets like 8 millimeters, you're like, all right, we need a PET scan or a 3-month follow-up. And then you start getting worried. But the thing is those 2 millimeter nodules could turn into something bigger, but how long do you follow them up for? Like, it's not really a set in stone, clear science.
It's like, could it turn into something in 5 years? Like maybe.
Yeah. But how long do you watch it for?
Yeah. But if it takes that long to turn into something, then it's like, it's not going to kill you in the next 25 years. So who cares?
Yeah. So that's that. I digress. Jim, what's our next topic?
All right. So our next topic comes from a story I found from the New York Post, the newspaper of Michael's hometown, New York City. And apparently a man by the name of Jake Eberts was paid for a scientific study. His Twitter handle is @WokeGlobalTimes, all one word. And he was paid to drink a quote unquote poop smoothie that gave him life-threatening diarrhea for science. And apparently what he agreed to do was drink a cocktail of Shigella toxin containing bacteria.
What?
To give him dysentery. And he was paid to do this. So he voluntarily got dysentery.
What? They used to kill people back in the day, by the way.
Yeah.
Sorry, not Shigella bacteria. But I think the name of the toxin is Shigella toxin. Anyway.
Yeah.
Wow. 26-year-old Jake Eberts agreed to drink a life-threatening concoction of a cloudy, salty liquid containing Shigella bacteria. And I got news for you people at home. My major in undergrad was microbiology. You don't want anything to do with Shigella bacteria.
No.
I'm just going to tell you that right now.
No, that's
What?
horrible.
Wait, what did he get paid? Do you have the article up?
So that's what I want you guys to guess. How much do you think this guy got paid to go through the worst 24 hours of his life before they gave him IV antibiotics?
I bet it was like $500.
Wait, so he had to do it for 24 hours?
So first I want you to guess. So he got dysentery and then they treated him for it and they studied. The article doesn't really mention like what they studied. Here we go. They wanted to test the effectiveness of the Shigella vaccine and he received a payday in exchange. So he took a vaccine and then got Shigella.
Oh, so it was like a pharmaceutical company that paid him?
Yeah. So what do you think he got paid?
Okay.
And so I want you to guess what he got paid and then how much it would take for you to voluntarily get dysentery for a medical study.
I feel like you go. I bet it was shockingly low number.
Yeah, of course
money.
it is. Of course it is. Because someone's gonna do it for lower. You know?
Yeah, there's always someone that's like, I'll crap my pants for a day, whatever.
Yeah, they don't know what Shigella. They're like, look, they probably tell them like, look, you're gonna get some diarrhea, and they're like, yeah, I'll do some diarrhea.
Well, they're like, you might die. We don't expect it because we'll be right here. And
we'll
he's like,
some fluids.
He's like, what am I gonna die?
I would say 2,000.
I would say $500. And look at that.
Oh my God, he just did the beaker straight up in the beaker, huh?
Yeah,
dude, that's like
from the beaker, bro. Beaker.
Dude, that's like scary. It should be like, I'm drinking something I know for certain is gonna. $7,000.
$7,000.
Yeah.
Wow. What did do it for that?
The university paid him $7,000. Hey guys, I got news for you. I might do this for $7,000.
What?
I was like, it's
Are
kind
you
of
out of your mind? I wouldn't go anywhere near that for 7,000.
This is kind of in my wheelhouse.
What? Diarrhea?
I would take
Stomach
diarrhea
cramps?
For $7,000.
Bloody diarrhea is in your wheelhouse?
Worst stomach.
Alex, I'll have diarrhea for $7,000, please.
Bloody diarrhea?
Who just had a stomach bug, and it was the worst 24 hours I've had in the past 10 years. I don't know, man. It might take more than that.
This looks like the face of a man who's $7,000 richer after having diarrhea.
I think it would take me. Well, let's see what happened first. I want to see.
This is hilarious. He goes, I don't want to make myself out to be Mother Teresa here. I would not have done this for free. It's a big ask to ask someone to get dysentery.
Yeah. No one was thinking you were Mother Teresa.
What?
No one would even.
The entire time I was like, wow, this. Jim, let me read it.
The entire time I was like, wow, this is an awful disease. And I just got really emotional, probably because I was delirious.
Oh my God. Hold on. Let me see more. Why do you keep changing it?
Hold on.
This dude, he's like, now I don't want to be made out to be Gandhi or Mother Teresa. I
don't want to be a hero.
Jesus Christ himself, but it wasn't easy.
Oh my God. So what were his symptoms? Did he list them besides diarrhea?
Dude, I just imagine how inflamed your colon is while you're doing that, your small bowel and stuff.
Oh my God.
And
I
you're just
can
getting,
imagine.
it's like beet red and just getting destroyed.
Beet red. I can only imagine.
Inflamed.
So keep scrolling down here. Blah, blah, blah. So they're doing this all for a vaccine. He had cramps, chills at first, quickly took a turn for the worse. He had 103-degree fever, diarrhea, and bloody stool. I truly felt like I could not move. I mean, what? I wonder how long it took. So symptoms 40. Oh, it took 40 hours for his symptoms to start. I would think it would be like that.
Dude, that's terrible. Also, like, you have to not know what's gonna happen. Like, one of us do it, we'd be like, I'd have the worst anxiety doing this ever.
Oh yeah, I would just be waiting for it to happen, you know?
Oh, okay. You're just anticipating the worst pain of your life.
Nurses gave him liters of rehydration solution or Gatorade. Didn't do anything. Yeah, I can only imagine that it didn't do anything.
Dude, I'd be like, put me on a freaking propofol drip before this starts.
I'm just gonna mute Jim. Let's just leave him out. Yeah. So the question is, let me mute him because I don't want to hear him.
Mute you.
I'm literally gonna mute him. Yeah, I'm literally gonna mute him.
This guy, he just drinks his drink.
There you go. He's muted.
Yeah.
So the question is, because I don't care about Jim because he's muted. Let him trying to talk and
He's still doing it, yeah.
frozen. How much would it take you to do that?
Me? I mean,
Yeah.
I know my number is significantly lower than yours. That's for sure.
What is it?
God, it would probably take like 20 grand or something like that. I feel like
20. That's it.
Yeah, I mean, it would suck, but like that's a lot for 2 days.
I mean, bloody diarrhea and that feeling like death for 2 days and maybe dying.
Yeah, maybe you're right. Because if I wasn't sick this past weekend, I probably would say like around there, maybe even lower. But it was horrible, and that wasn't even close to what this guy went through. So
I would probably say 100 grand.
You know, I was thinking. You know what my number is?
What?
$7,000.
Go back in timeout.
I would definitely do this for $7,000.
Would you
I'm pretty sure I've
really?
had this before traveling in Africa. The way he describes it, I was stuck on a plane and had this, and like if you would just give me $7,000, I would be like, okay,
You would be like, oh, now I'm fine.
yeah.
What if you got life-threatening dehydration?
I mean, you're in a hospital. It's a controlled.
Oh, that's true. That is
environment.
controlled. I will say that.
Yeah.
But I mean, that's no joke, though. So basically, this guy's risking his life for $7,000.
I guess there's a very, very low risk though. So it's like
It is low
in the
risk.
setting. Yeah.
But man,
But this-
why
at the
do they
same
have to
time,
give
what
him
if-
so much?
Dude, just the thought of being like that viral or the like just the initial load of being like pure toxin going into the
Oh, why didn't they just like give him a little baby dose or something?
yeah.
He went full on.
Did you ever see the like Wim Hof? They gave him
Who's
like
Wim Hof?
so this guy who created this
The
like
guy
breathing method.
The breathing method.
Yeah, the breathing method guy. So they gave him God, what's the thing E. coli has that makes you septic?
H5 or the
Like
0157.
Yeah, like
0157.
yeah.
Yes, the 0157, I believe.
Yeah, something like that. So they gave him they gave him that toxin to basically make him septic.
Yeah.
To see if he can because he can alter his like pH system basically with this breathing method. So like I don't know the specifics of it, but he like increases.
So he's trying to compensate for his metabolic acidosis.
Yeah, he literally becomes alkalotic and like through this whole breathing method and stuff and like this deep breathing exercise. And so it actually like they've literally run tests on him because of the way he breathes. It actually like alters his pH. And they gave him the thing.
You can alter your pH, but you can't alter your pH enough to battle a toxin.
He did. They
Did he?
Yes. He did.
No.
Yeah. He's the one that he'll has like the world record underwater swim and like the Arctic and stuff like that. And he's like, it's
what?
like his like corneas froze. I was listening to a podcast with him. His like corneas froze. And he's like, problem is I couldn't see anything because my eyes just froze. He's like,
he's an enigma.
Yeah, he's like an enigma. But they gave him like that thing to make him septic, and he basically like fought it off. It was like the weirdest. Everyone's like, it's the craziest thing ever.
That guy must have the strongest willpower
Yeah,
of all time. I mean, how septic was he? Was he in like septic shock? I don't think you can battle that off with your damn breathing.
No, I don't think you ever.
He can't even do that on a vent. I don't know what he's gonna do breathing on his own. I don't know how he's gonna do these alkalotic breathing when he's comatose.
Here we go. Yeah.
In septic shock here.
He's intubated and he's like, why don't we just do that with a ventilator? It makes sense.
I mean, people die on ventilators with septic shock. I don't think he can just breathe through it.
This guy.
I mean, what?
Yeah. He's like crazy. I forgot like the specifics. Let me see.
Is he dead?
No, he's alive.
Oh.
The guy's insane though.
Iceman?
The Wim Hof method, he calls it.
So what is it? Just retaining CO2?
Yeah, I can't remember the specifics of it. My acid-based knowledge is an abomination.
Yeah, people use it to combat altitude sickness.
Yeah. Oh yeah, that's right. He climbed Everest without like shoes or something like that. Yeah, it's like something great. Or he definitely didn't use oxygen and like or something like that. It's like some crazy thing.
I don't understand the point of this. I mean, bro, just use some oxygen.
Michael, you don't like when people like push themselves to the human body's limits and like do crazy things like that. You really don't resonate with that.
I just don't understand. I'm like, why would you do that? Why would you risk your life when you don't have to?
Yeah. Michael's got the whole. He's like, just do normal.
Play it safe, bro. Just play it safe. Put some
Yeah,
shoes
Michael-
on. Maybe stay somewhere warm. Use some
Michael is
oxygen.
Michael's entire life is just like the dink and dunk offense of a quarterback who doesn't know how to throw past 10 yards.
He's a Mitchell Trubisky of it.
He's Mitchell Trubisky life. That's exactly right.
I don't know what that means, but I'll take
Dink
it.
and dunk.
Yeah.
Dink and dunk.
Can't
All right,
take
guys. So, so to summarize, my number was 7,000. What was your number, Michael?
100,000.
Tommy, 20.
Hold on.
Yeah,
do you want me to host? Tommy, what was your number?
Mine was like 25,000, somewhere around there, I think.
25,000.
Okay,
All right.
I would definitely do this study for $7,000.
Jeez
Louise.
Jim's like,
Well, they might reach out to you.
Yeah, Jim's thinking about lowballing him. He's like, hey, if you do me over him, I'll do it for 5.
Hey guys, I'll do it for 6.
I mean, only Jim would lowball for diarrhea. I mean, what?
I think we just found the title of this episode: "Low Ball for Diarrhea." All right, moving on, guys.
All right, what's the last segment? One more segment, and I can get your damn internet off.
Let's see if his internet can go.
I was gonna do 2 more segments, but we can cut this down.
All right, we'll see. We'll see how it goes.
Guys, oh my God, get this ad out of here. I hate CNN.
Raven Builders.
Edit that out. Biden.
Yeah, I'm gonna block it so no one sees it.
Biden's taking a hard look at student loan debt, but not considering forgiving 50 grand per borrower. Guys,
What?
I just
what's the
wanted
point?
to. I just wanted to bring up
Seems
the
like
issue
a
of student
soft
loans.
look.
Joseph Biden is considering dealing with some debt reduction, but he is not considering 50 grand worth of reduction. He said at the
So
White
what
House.
So what are you considering?
He's taking a
$500.
hard look at whether or not there will be additional debt forgiveness, and I'll have an answer on that in the next couple of weeks. So, guys,
So nothing.
Yeah, my hopes are
Should-
low.
all right. So I have about. So I owe about $77,000 worth of student loans.
Mm-hmm.
My wife and I have about $100,000 liquid cash.
Mm-hmm.
Should I pay off the student loans?
What does that have to do with the story?
Nothing. But
What's your
I
interest
mean,
rate?
it has to do with the story because, or should we wait and see if Joseph Biden remembers
Well,
student loans?
Here's the thing. I think what's going to happen is he claims 50,000, and then he says it's not going to be 50,000. And that's a strong if, this.
Well, he's not
bill-
claiming 50,000. He's saying that it's not going to be 50,000. Just period.
That's what I'm saying. So the fact that he says it's not going to be 50,000 mean it's, even if it gets passed, it's going to be at least like 30% of that at the most. You know what I mean? They'll be
Do
like,
you think?
they'll be like,
do you
all
think
right,
we would all
we'll do
qualify for a
10,000.
reduction?
No, 0% chance. They would all be like, oh, we'll do, $2,000 per person that's in student loan, and then they have to be in like public service or like some sort of 503B or whatever the nonprofit is, or they'll
Yeah.
be like, or there'll be like income levels and be like, well, you guys make too much, so we can't give you forgiveness, but also $5,000 doesn't really do anything for us. And I refinanced my loan, so I don't even think I would qualify altogether, regardless of all those other scenarios. So I think it's just, and probably nothing will happen.
Yeah,
Okay.
I think it's just something
So-
people say because it's like,
Yeah.
My actual curiosity with like student loans is, I know it's like one of the biggest sources of debt of the United States, basically, or like United States citizens. But like, does the government make like money off of those, or like, is it a
Yeah.
steady?
Yeah, they made
Okay.
interest off. Of
Before you refinance them with like SoFi and Mohila and like private companies like that, like if they're government federal loans, they're making the interest. They're just serving as a bank, as far as I
Okay.
understand.
I just
it's
feel
free
like
money.
I guess that's true. I guess I assume that like people are barely paying off their loans, and it's like that does nothing. But
The government is making money off of the people they are trying to educate to better the country.
yeah.
Right.
So I
People
mean,
people
zero
keep
shot against that.
refinancing their loans. It just means a private company pays off the government to take over their loan care. That's
Right.
all.
So
Okay.
they still get paid regardless.
Okay, that makes
But-
Oh,
sense.
yes.
The thing is though, what's your interest rate? Because my interest rate's 3%.
4.5.
So that's still good. I mean, especially now, and inflation's 8.5%.
Yeah.
You know, I don't know. I mean, I go back and forth whether. I mean, it depends on what you have, because that's kind of not really. I mean, it's all relative, right? So with your income and your liquid cash and dual income, that's not really that much to fret on.
Yeah, we pay about $500 a month in student loans.
Yeah, I mean that's not bad. I mean, I pay a lot of money in student
I would
loans.
wait until you see if anything else comes.
You guys have so much more debt than I do.
So much more debt.
So much more.
So much more debt.
Honestly, the pandemic is the best thing that's ever happened to my student loans because
It's got paused.
Yeah, it's been paused. I haven't had to pay it off. It's collecting no interest for literally like almost my entire residency.
Dude, you've gotten so lucky. You've had during your residency, your student loans have been paused at no interest.
Yeah, for literally
The problem with that is,
I mean, what a great time to be a resident.
Oh, it was perfect.
Tommy, you timed it perfectly. Congratulations.
I did that on purpose.
I know. I only got to take like advantage of that for like a year. But the problem with that is now the interest rates are going up. So when you refinance it, you're refinancing it. You know, you'll refinance like 2 years from now, or whatever. And the interest rates, they may come down for that. But if you're trying to refinance like towards the end of this year, you're kind of going to be screwed because your interest rate's going to be, 5-6%, what it is with the government. So like, it's good that they're giving you guys this break, but also, your interest rate is going to be affected going forward.
Yeah,
they're not going to give out the 2.75% interest rates like they were for us.
Yeah, well,
I can assure you that.
Still pause. May hurt me in the long run, but for right now, it's been okay.
Yeah, no, it's fine right now.
All right. And moving on to the final topic today, I am going to quiz you guys.
Oh God.
I like quizzes.
General medicine stuff or
no?
I hate quizzes.
Pop quiz.
Quiz, bro. This is a combination of like quizzing Michael and Tommy and also the vet corner. All right, guys.
Yeah.
There you go. In human medicine, do you guys have like different types of ataxia? Is there like 3 different types of ataxia?
Yes, we do.
And what are the 3 types?
Dude, I don't know.
Jim, you're a neurologist, neurosurgeon. We do nothing neuro. I didn't even do a neuro rotation.
Yeah. I did neuro rotations, but it's like
that was my neuro is reading an MRI brain. That's my neuro.
Okay, so the 3 types of ataxia are proprioceptive, vestibular, and cerebellar.
That's right.
Okay. I knew that.
Yeah.
Okay. Yeah. You guys,
not off the top of my head, but
I'm familiar.
Well, it was right there. All it took was me saying it, and you're like, "Oh yeah."
Can you categorize the different types of proprioceptive disorders off the top?
That's not what I'm saying.
If it was multiple choice,
you got to realize though, Jim, we haven't studied this stuff since our first year at med school.
That's fine. I'm not asking you to be experts.
You idiot, Jim. I hate you.
Okay. Well, I hate both of you.
I don't
talk
care.
To me again, and you're never going to see your niece again.
I don't care because this quiz obviously means nothing. I'm just telling you that's the last time we have studied like neuro stuff.
Michael, I'll bet you your YouTube channel that you know what this is.
All right, hit me.
So, okay. So, of those 3 types of ataxia, what do you think this dog has?
Friedreich's ataxia. How am I supposed to know?
Well,
you've got a proprioceptive
chance.
It's not proprioceptive. I mean, he seems a little wonky back there. Let's do some cerebellar. You want to go with that, Tommy?
Yeah, I'm going with that.
Cerebellar. What was the? I forgot the third one actually.
Oh, little buddy.
You are correct.
Hey,
this dog has a cerebellar ataxia. See how he is very spastic when he walks?
Yeah.
And he's kind of like hypermetric and he's disinhibited, but he's not.
Who the hell knows what hypermetric means in the audience? Jim's like, you see that his corticospinal tracts are deviating.
But look at his front
leg.
legs.
You use some layman's terms.
Yeah.
See how
you know how to speak layman?
Yeah. I'm trying to.
Jim, pretend I'm an idiot. Not
both
that
of you are layman's. So see how his front legs. Watch his front legs. See how high they go.
They look very dysmetric.
See exactly. See how high he's like a toy soldier.
A toy soldier.
Yeah, you know, like the
marching.
Yeah.
You see how high his front legs go? That is a spastic sort of movement. So this is a hallmark cerebellar ataxia. This puppy.
He does seem like he's marching.
What does he have? A tumor?
So he has a condition called cerebellar abiotrophy. And there's two big cerebellar conditions.
One of my favorite diagnoses.
Yeah. Is it?
No, I don't know. Never heard of it in my life.
Okay. So there's two major cerebellar conditions in pets that people know about. The first one is the most common, cerebellar hypoplasia. Hypoplasia means you're born with a less than normal structure, is what hypoplasia means.
Heard of that. We got that. We got that in humans.
The most common situation being cats who are born with a less than normal cerebellum, and that's usually due to a viral infection of their brain, the panleukopenia virus. And in the other condition that is commonly seen, usually in dogs, is abiotrophy, meaning their cerebellum is born normally, but once they are born and during puppyhood, as you see in this dog, it's a puppy, their cerebellum starts to die off because the word abiotrophy means lacking a nutritive substance. A means without, biotrophy refers to the nutritive substance. So their cerebellum starts off normal and then it dies off.
Which nutritive substance, Doc?
I don't know what exactly it is. I don't think they do know, but the cerebellum just starts to degenerate. And the difference between these two scenarios is, one, cerebellar hypoplasia, whether it's a cat or a dog or any other animal, they are created that way. They stay that way. They don't start off normal and get worse. They just are that way their entire life, and they don't progress and they can live a normal life. Whereas cerebellar abiotrophy, they start off normal and then they get worse, and they often continue to worsen. And there's other motor systems that get involved oftentimes with different forms and kind of subtypes of this disease. Gotcha. And they progress and actually have a poor quality of life that's not treatable, and they're usually euthanized. Okay. So that is the difference. Everybody knows about cerebellar hypoplasia. Not everybody knows about cerebellar abiotrophy.
But now they do.
Diffuse cerebellar atrophy and like cerebellar hypoplasia. So here, let me see if I can share.
Some congenital.
Yeah. So and
I'm sure you see this in people.
Like Dandy Walker and stuff like that, Michael?
Yes, with Dandy Walker is described. You can Google Dandy Walker dog MRI. You can see an example.
Look at that.
Yeah. So there's
look at the Tommy just pulls up the MRI automatically here.
Hold on. Before you guys tell me what's going on, is this Dandy Walker syndrome?
No, this is not Dandy Walker.
Okay.
No.
So, but what I'm seeing is the cerebellum has shrunken and it's being filled in by CSF.
Yeah.
Where the normal cortex should be.
Yep. Correct. It's a T2 sagittal.
It's a small cerebellum. Now, if you Google
cerebellum,
you sometimes see that in dogs and sometimes you don't. But if you Google, but that's hypoplasia.
Yeah, it's just hypoplasia.
But Dandy Walker is like cystic expansion of the posterior fossa.
So look up Dandy Walker in people and then Dandy Walker in dogs, and you'll see the similarities.
Let me stop sharing.
Because it's very well described in dogs
and humans.
There you go.
There we go. Hey.
Now, if you can, I don't know if you can finagle it, Tommy, but if you can bring up a dog MRI.
Look at that little cerebellum up there chilling.
That's a little guy.
Little teensy.
That's a little kid too.
Yeah, they're always diagnosed young.
So just Google Dandy Walker dog, and there is your dog with Dandy Walker syndrome right there at the top.
Yeah.
So different.
I'm assuming this is your tiny little cerebellum.
That's a flare or a T1. I can't. I think that's a T1.
I don't know. It's hard to tell that.
Yeah. So that is a T1. So yeah, you can see. So that is a dog right there. You can see the red arrows and the yellow asterisks where Tommy's mouse cursor is sitting. But that little remnant of cerebellum, and then you go to the person.
Here we go. Oh, no, that makes it better. So a little tiny cerebellum. Then we'll go person.
Then you go to the person. Different sequence, but same idea where the cerebellum is really small and there's a lot of CSF kind of filling in.
The vermis is hypoplastic.
Yeah. So there you go. So that people know, comparative anatomy is like one of my professional kind of hobbies. I really like reading about and studying this stuff.
Is it? You do love comparative.
Yeah, you do. Yeah, you do.
He sends dog MRIs. He's like, "What? Is this crazy?" Or like, "Yeah, man, I guess."
Yeah. Sorry, I'm passionate about my job, unlike you automatons over here.
Automatons.
Normal study period.
Yeah.
Can I check my fidelity folder?
God, folder.
What an
All right,
idiot.
Jim.
What's up?
That was a good lesson, actually.
That was a good lesson.
Hypoplasia. Yeah.
That was your lesson. And
Thank you.
I think that that's time for this one. Jim, send
All
us
right,
out
guys.
as usual.
All right, guys.
Jim, this whole time he's doing the outro, I'll just do this.
Yeah.
That's what we see all the time.
Yeah.
Hey, Tommy, what sort of content do you have coming down the pipe this week?
You know,
Nothing.
I've got
Okay.
on my
Michael, what sort of content do you have coming down the pipe this week?
Well, I already told you about my one video that's
Yeah.
coming out the same time this one, probably an hour after this one. So, maybe do a little preview to what's coming down the pipe. I've been liking these deep dives into the medical cases lately. But I only want to do them for the high profile cases. People love them for some reason. Like it's fun to do because I literally have to dissect all the cases and read through everything. It's kind of fun. It's time consuming, which is annoying, but it's kind of fun when you get a nice video pumped out. But but it's you got to have the high profile medical cases, to do that content with. And when the next one's
looking for a veterinary one, but I can't find one.
I don't want to do I don't want to do ones from 3 years ago, or 5 years ago. I want to do recent ones. Yeah. So that's
you don't want to do the John Benet Ramsey case?
Yeah. 1990 or whatever. Yeah.
So that's cool. I'm probably not going to get a video out this week, but I've got a bunch of interviews lined up. I've got an interview with a nutritionist where we're going to talk about vegan diets and dogs because a study came out that's, in my opinion, complete BS. But everybody's looking at this study like, oh my God, this proves that vegan diets are the thing to do.
Oh, I love this controversy.
Yeah, so we're going to talk about that. And then,
the title should be.
No.
Confronting vegan nutritionist.
Okay. Sure.
I'm just going to also go on a limb, say there is no world where a dog's diet should be vegan.
Correct. You are correct.
Why would they
I'll give you
evolve
guys
to be a dog or a carnivore or in a hunting pack?
I'll just tell you right now, the study was a survey study where all they did was just survey owners.
Oh, cool. Yeah.
And ask them if their dog was healthy or not. And then
he barks less. He barks less, so he's
I got
healthy.
news for you. The owners that fed their dogs a vegan diet perceive their dog as healthy more often than owners that didn't.
Yeah. I'm sure. I think that's an unbiased study.
Yeah, totally unbiased, randomized, placebo controlled, the works.
Yeah. Double blinded.
We're going to talk about that, and then
the same efficacy as the vaccine. Am I right?
Yeah. So stupid. And then a year ago, some stuff came out about flea and tick collars killing dogs because somebody said their dog died mysteriously, and they also happened to have a flea and tick collar on. So obviously, causation and correlation are the same thing, right?
Obviously,
right. So I'm talking to the head vet of the pet poison hotline, and we're going to do a YouTube interview, and we're going to dig to the bottom of that.
That's awesome.
That's really cool. I may watch that one.
I want to go down the interview routes. I want to be like interview.
You should. You're good at it.
Dude, I've been sending so many goddamn emails to people over the last year since I interviewed that nutritionist, and nobody has any interest in talking to me.
Well, it's
the last week.
You have to find the right person. You have to find someone who's willing to come on camera.
Right.
And, B, has to have some sort of motive to they have to have self promotion or something.
Right.
Yeah.
Right.
Because otherwise it's waste their time.
Yeah.
So I mean it's a limited resource.
And then finally, I want to interview. I haven't nailed this down yet, but there's a vet named Hunter Finn who's got a massive TikTok and Instagram following, and I want to reach out to him. I've messaged him before, and we've had DMs back and forth when his dog had a neurologic problem. So I think he'll probably maybe answer me, but we'll see. But if I can get
sweet,
I want to talk to him about being huge on social media and what that's like.
Yeah.
He has he's 500,000 followers on Instagram, and I want to say 2 million followers on TikTok.
Yeah, get him on. I'm curious. That's something. I mean, even non-vet people will like too. I like to hear that stuff.
Have you ever interviewed anybody?
Me? No,
Yeah.
but I've done podcasts for
I know
my,
you've gone on kids who like med students and stuff.
yeah, I liked it. I mean, because I remember when I was in their shoes.
I
It's
saw
kind
one
of
where
fun.
these two kids were asking you like what you should do financially as a
Yeah, that was my boy Andy and Win.
oh my god.
He's the one that he came to my apartment. He's a
I
med
was
student at
I was
MCG.
watching that and commenting like, don't listen to this guy. By the way,
So funny.
Art K down 85% since
Oh.
Michael told me to invest in it.
Yeah.
God,
Here goes that
I
money.
told you to do it. Yeah, I mean, you have to, I'm down so much.
Michael told me to get into Palantir at $22.
Okay, I also told you to sell it. And actually, no, I didn't tell you to get it at $22.
Yes, you did. And you never
Actually-
told me to sell it. Yes, you did.
No, I told you I sold it, and I said you should sell it too.
Do
And
not
they dropped
gaslight me. I'm ungaslightable.
dropped to like $10 or something. He's like, "Should I sell now?"
Yeah, no, that's not at all what happened.
Should I
Okay,
sell
let's
that?
wrap this up. Guys, don't forget to like and subscribe to this podcast. Like and subscribe and comment and all that good stuff to at Dr. Cellini and at DVM Cellini. Tommy is a total non-factor as he usually is. He has no social media presence whatsoever. He had a stomach virus this weekend. He'll probably have a cough or some sort of upper respiratory thing this weekend. He's sick, act like his back hurts, all that stuff. Guys, we'll see you next weekend. Have a good Sunday and the rest of the week. Stay healthy. Cheers.
Don't get Shigella toxin.
And don't drink Shigella.